let's get started. Or continue. Alright, so let's not forget kinesiology is studying movement, right? And so we need to know the parts that are moving and how they're related together. Okay? So we're going to we're learning all the parts of the system before we talk about how they move. Okay, if that makes sense. Okay? So, and biomechanics, of course, is movement of the human body. So 7, 8, and 9 is about kinesiology. 7 and 8 are the bones, 9 is muscle. Okay? Then after that we'll go switch to trail guide. There will be some times where we will still reference some pages in here you can refer to. They'll use different pictures. They'll have different terms sometimes that aren't covered. So I'll have that listed for you in your weekly assignments, like refer to ESSN Essentials book, and I'll have the page numbers, okay? Alright. So, we have what's called an endoskeleton. It is inside our body. We do not shed it like there's some insects and there's marine life that they have to move to a bigger shell or grow, like snakes shed their skin, right? They get bigger. They're too big for it. So we grow around our skeleton. Bones connect at a joint, and that is called an articulation. Muscles the bones articulate at the joint. So do be able to identify that word as your new term for joint, an articulation. Okay, so when we have the muscles come in with the bones, that's called our musculoskeletal system. Okay, so our skeletal system has bones, joints, and connective tissue. The muscles have to attach to the skeleton. The major functions of our skeletal system is support of our soft tissue, so it's the frame or hanger of the body. Everything attaches and hangs off our skeleton. There are attachment points for both ligaments and muscles. You'll be learning about those later. They also can provide protection for our organs, such as our brain, which we'll talk about first, and then also our vital organs, heart, lungs, for example. They provide movement by being a lever for the muscles to work with, to pull on. They also produce our blood cells, store minerals, and fats or lipids. So when the body can't get energy, it can go to the bones. That's not its first source. We don't want to weaken our bones for that, but extreme starvation states, you start getting brittle bones because our body needs energy. It's going to try to survive instead of just die. Because, hey, we got some fat stored in the bone, let's get it. Okay, but then you have an empty bone, and that's not very strong. You empty out the center of it. Okay? So, when we are an adult, we have about 206 bones on average. There's, a little bit of a wiggle room. We have more when we're a baby, up to 300. So they start fusing together and becoming larger bones as we grow and are an adult. Females can have an extra rib than males. Sesamoid bones can be different number of them. Again, our sacrum is 3 to 5, so it's going to vary from person to person. What else? There's other little bony prominences that some people will or won't have, or they may be fused in some individuals into one bone. Okay? When we talk about bone tissue, it's called osseous. Okay? Osseous tissue is bone tissue. We learned that prefix back in chapter 2 and 3. Okay, it is 2/3 inorganic, okay, rigid. It needs to be firm, but it's a third elastic, so it can have some movement. We don't associate with bones, but that allows it to withstand force of falls, pressure without breaking. Okay. Piezoelectric is important. This is their ability to slightly deform or vibrate whenever it's taking on intense pressure or we're passing the currents through it. Some people use TENS units and things like that. So that allows them to vibrate again instead of deconstructing. Okay, now looking at the bone structure. Bones all have a common rigid matrix. They are a connective tissue. They are covered with the periosteum on the outside, and that allows for attachment sites as well as growth. It's not a closed in, it allows for some growth and nutrition. The skeletal system is important in structure and function. They work together. The ability to grow, the ability to be rigid and supportive, the ability to provide nutrients. So they are tied in together. Can you think of another time when it would be important for bones to have nutrients and a open end that the periosteum provides, besides normal development from childhood to adult? Can you think of another good use why bones have nutrients, as well as they're not exactly closed in, they have the ability to grow and function? Say that one more time.
Because you haven't finished developing.
Well, I mean, once you're an adult, though.
Oh,
Yeah.
Well, adults,
Besides that,
we change. I mean, like, women go through childbirth and our bones have to move around and whatnot, so our bodies change in different regions of life.
right?
So the adaptation.
Right? Like, depending on what work you do, if you're pounding a certain part of your body, it's going to re-support that with extra bone, right? Sometimes you like that. Sometimes you like, hey, I don't need that. Shave it off.
Okay.
Also, do you have an idea?
Honestly,
That's a hard one.
because I was gonna say, I mean, you have to do it when it comes to your job and how you react to things, and then also, I mean, to a certain extent, if there has to be some flexibility to them, not a tremendous amount because they hold the structure up, but say you have an impact of some type, so they have a little give them, so that way the bone, unless the impact's severe enough, it won't break. So if you get like hit by a car and stuff, your bone has, and you get hit like from the side, it doesn't necessarily mean that your bones are going to break because they have that little bit of flexibility on just to give just enough to where it's like, okay, they can absorb the impact a little bit.
Good. But also, if it does break, it has the ability to repair itself. It's got nutrients. It's able to, a fracture or something, you can bind it and protect it, it will repair itself. Yes, it's slower than softer tissue, but it can happen. Good. Got y'all thinking outside the box a little bit. Okay, so we have different types of bone tissue. First, we're going to talk about compact or dense bone. Okay, so these are the main shaft of long bones, so the center, like your femur or your humerus bone in your arm. Okay, they're not going to be your little tiny bones like your carpals and your wrists. They protect spongy, softer bones and provide the main framework for the body. Okay, that's important. So the outer layer of all our bones have that, which we need to be more dense and protective. Spongy bone, this is different. The second type is also called cancellous bone. It has a lighter matrix, more space in it, which you see that picture on 196. I'm going to go ahead and move there. There it is. So you have dense bone, and you have here you have the spongy bone on the interior. So there's more space. It allows for other substances to move, as well as more shock absorption, right? So there's kind of meshing of the plates there, and we can produce our red blood cells here. It also makes your bone not so heavy, since it's not completely dense all the way through. Like if you have a piece of wood, right, that's, no matter what size it is, if the center of it is cut out, it will be lighter. So in some cases, we have strong structure, but we have hollowed out the middle of it for ease of transport, or we can fill it later, right, with insulation, some house construction materials. It's not completely dense, and that also allows it to move a little bit, right? We have storms or natural disasters. So the body is built, or that's built with the body. Okay, first. Okay. Bone marrow. Go back. We have red and yellow bone marrow. You need to understand the difference. Red produces your blood cells. Yellow is mostly fat. Okay, so storage for energy. But the red marrow produces our blood cells. That's another reason why when someone breaks a very, very, very large bone and they're old and it takes a long time to heal, it's not going to heal as fast or as well, and it can't be creating blood anymore. So if you're not replacing your blood cells, they get replaced daily or even faster when you're younger, that's going to cause breakdown. Okay. The periosteum and endosteum. The bones are covered by the periosteum except for the ends, because that's the growth plates are there. And the osteoblasts are there, which are able to repair the bone, rebuild if needed. Okay, the endosteum is thinner, and it is the lining of the marrow cavity. They both help with growth and repair, but periosteum more so. Okay. Structure, let's see. Bone development, we're on page 195. Let's talk about ossification. This is where we build bone using calcium salts put into the tissue. So calcification and ossification. Ossification is putting calcium salts in the tissue to start building bone. Calcification is another term for building bone. But mainly in this chapter we're talking about ossification. So remember, the OSS stands for bone anyway. Creating bone. It's two steps. We have the chondroblasts and the osteoblasts. The chondroblasts are for cartilage, to form cartilage. The osteoblast is to build bone. Okay? So the chondroblasts come first, kind of like the soft outline form it should take, and then the osteos come in with a hard, dense material. Okay. Articular cartilage. We have a lot more cartilage when we're younger. We're softer bones, and that's great for birth and for falls. That's why young kids, they fall down, they act like they didn't even know they fell down. So it's more spongy, right? So they can bounce right back up more, literally. As an adult, the only cartilage we have left is called articular cartilage. It is hyaline cartilage, that's sometimes interchangeably named. It's smooth, porous, and very malleable. It's usually found when we have bones coming together that are going to move freely. So shoulders, hips, things like that with lots of movement, you're going to have this hyaline lining the connecting points. and it allows for more synovial fluid to be there to cushion that, try to keep it lubricated well. And we massage it and help it to make more synovial fluid so it can slide better. Alright. Ligaments. And again, if you guys on here have any questions on the string, just type them. And if I don't see you within like 2 minutes, just unmute yourself and say it. Alright. Ligaments. These are bundles of parallel connective tissue made up of mostly collagen. Okay? The main thing. They are not typically elastic, but they do help to stabilize the joints. It's where bones connect together using ligaments. So ligaments connect bone to bone. Tendon, until our next week, connects muscle to bone. Ligament is all bone. Which is denser, ligament or tendon? Off the top of your head, educated guess. Ligament, yes, from harder to harder instead of from soft to hard. So ligament is going to be denser when you're going toward a joint. Sometimes people mistake a very not well hydrated, not well, no nutrients there in a ligament. They'll think it's bone because it's so hard. They can't tell the difference. Okay. So we have different types of bones. And when you don't have good blood flow, it takes longer to heal. So people that have disorders that slow that circulation down, it's going to slow all these other processes down too. They're going to have less energy, they're going to be colder, they're not going to heal as well or as quickly. Okay. So massage helps circulation, it can help a lot of other things that they might not come to you for, but they'll still get the benefit. Bone growth and repair is next, but first I want to highlight the different types of bones. So we have long bones, short bones, flat bones, irregular bones, and sesamoid bones. Yes, you need to know those. These are going to come up as we learn the bones, what type are they. So just review that so you get a preview, okay? So like I might say later on in the class, well, give me an example of an irregular bone. And that could be a question on your index too. Which of these is an irregular bone? So just start, showing yourself this information. So you'll talk about it throughout the whole program. But that way you'll get more comfortable figuring it out. Like the sesamoid bones, like our patella. I think that's really the only one that humans have with the sesamoid bone. There may be one other. Irregular bones is our vertebrae. Flat bones, our ribs, and our skulls bones. And then short and long bones. Long bones are easy. They're the long bones. They have the middle. That's where we have our blood is created mostly in the long bones. Okay. So growth and repair. The secondary, besides making us in the first place, our epiphysis is very important. Okay. That's the main part where we can continue to grow until we get adult at the epiphysis. Oh, I had a picture of that. It must be in the next chapter. The epiphysis is first paragraph in Bone and Repair, page 197. Alright, Connor has a question. So you have a cracked wrist or bone in that area. How would it be best to get that to heal? Please don't tell me you broke your wrist.
Yeah, that would really good.
Right, they're right, Okay. So, you would need to splint it to protect it, but not too long, because then you're going to have calcification and lack of blood flow. So I would splint it always at night, and anytime you were doing any kind of strain work for that area. So most of the time you need to wear it. Because it will force, you have to get the one that has the steel plate in it, because it will force the wrist to stay in a neutral open position. And so even if you're driving or you're trying to use your phone too much or computer or whatever, it's going to make it stay open. You'll have to adapt with your fingers or use the other hand. So, and for the blood flow part, that's a 2. Yes, you need blood flow, but that's going to be secondary to not causing further injury. Right? You want the best way to do it would be when you take your splint off, do alternating hot and cold to force the blood in and out of the area, and then put your splint back on. Alright.
Does he have one or
You didn't hurt your wrist, did you? Were all concerned. You didn't answer that question.
I didn't.
He says it might be cracked.
Oh,
Please take
God.
care of your wrist. Oh my
You
god.
might want to go to a doctor.
I wish you were here so I could check it for you.
Don't stick your arm in the door.
But
You're like, you might want to go to a doctor and get that checked. It's like, no.
what's making you think it's cracked? Pain with what movement?
For sure.
With any movement?
I mean,
I would get it checked.
like one good hand and then one.
Yeah, I would get it checked. I know that you're positive, so
Handed FRI.
maybe try virtual doctor appointment.
Let's get a fast pass.
But yeah, you need to splint it, and then a couple times a day do warm and cold on it so that it'll flush it. Alright.
COVID and fracture your wrist. Good God.
Free medical tips, no. Okay. Please take care. Okay, at least you're quarantining, so you have time to rest it up. Okay. Alright. Yes. Don't, when you buy, make sure it has it can't be bendable. That won't help. They have them at Walmart.
So you can get,
Just make sure it has a,
so you can get a.
he can do a
He can
pickup
deliver
order,
it,
and
right?
pick it up for him.
Yeah.
They'll have 2-day delivery, there you
I know you
go.
can do the wrist straps and stuff, cause I have some where it's like it'll teach your hand basically like that. It don't give no good. And you can get them at like CVS, I know.
Well, yeah, but if he's gonna order some, he might as well.
Yeah.
It's like,
I got some,
$14.
I got some
Okay, you're welcome. Alright. So, moving on. Okay. Speedy recovery on both issues that you're having.
Yes.
Okay, at least they happen together. That's a good thing. We gotta look for a silver lining. I mean, I don't know what your job is, but at least you have to be home so you can rest it. That's what I'm saying. I'm not saying yay, it happened at all. Moving furniture. Yeah, you don't want to move furniture with the wrist. You might want to continue to wear the splint after you go back to work too, just for protection. It'll force you to hold things properly for your wrist. Okay, that way you can become a massage therapist, not be injured. But those are side notes. Okay. So we're still on 197 in the book. So the growth plate is called an epiphyseal disc. And they're at the end of long bones, okay? And they usually stop growing, around 20 or so. Less or more depending on if you are a female or male, and when you go through puberty, of course. So, of course, children have more cartilage, as I mentioned, adults have less, and then as you get older, your bones get more brittle because there's less blood vessels. Usually there's less blood flow in the average adults. And so that makes your bones more prone to cracks and fracturing, and it slows down the healing process. Then when you add in with that an older, overweight person, that's more strain on the brittle bones, and it just makes it even. So there's other factors that come into play. So that's the next section. changes caused by aging. Around 40 or so, our core vertebrae are thinner and not as rigid and nice and thick, and so we start losing half an inch of height every 20 years after that. The cartilage also on our ribs starts calcifying, so that leads to less flexibility in our ribs, reduced oxygen, blood flow, and nutrients for our blood and all that. So you can see how having a regimen of massage in some fashion improves your quality of life.
Would also just regular activity
Yeah.
improve that, so that way, like, it would kind of slow, I guess, the growing process, to some extent.
It depends. There's a combination of things that you need to do.
But, like, I mean, I know a guy he fought in World War II and everything. I mean, I saw him a couple months ago, he's 100 years old now. He retired last year,
Right.
and he laid brick every day.
Mhm.
From the time he came back from war, so.
Right. The more active you stay, you're continuing the process, you're continuing to losing your flexibility, your activity levels keeping your blood flowing, pumping. So yes, being active is better than being sedentary, losing all of that good stuff. So yes. Okay. Now about the bony landmarks that we're getting into on page 198. Whoa. That was in the wrong. I gotta fix that. That's in the wrong order. But I went over that. Okay, so bony landmarks. We have different names that you can go over this week to start familiarizing yourself with. Do I expect you to have them all memorized? No. I'm going to tell you which ones are key right now. Foramen, which is an opening or hole in a bone. Fossa, which is a depression at the end or surface of the bone. A shallow depression. A notch, a sinus, which is the air cavity inside of a bone. We know a little bit about those. Processes, condyles, facets or facets. That's where we're going to articulate from a vertebrae to a rib usually. The facets, which are going to be on your vertebrae. Processes are on lots of different bones, but they're little finger or little nubs coming up off the bone, sticking up that you can feel. Like we have our spinous processes, right? We're all familiar with those, and those are the easiest ones to remember. They stick out, you feel them. And then if we get a little bit more specific with ones where we're going to be using a lot with our muscles, because they're going to be attachment points. Epicondyles. These are specific projections off of a condyle. So they're always going to be near a condyle. And you'll have an epicondyle with it. They usually come in pairs. Trochanter, that's only found in our femur. Tubercles, these are small round processes. They'll be all over the place too. But these are very common where things are going to be attaching on the ends of bones. So, now, the axial and appendicular skeleton that we talked about. We know the axial is our head, vertebral column, ribs, and sternum. That's it. Okay? Our appendicular is everything else. All of our appendages or limbs, our arms, hips, that includes our pelvic bones.
I'll never forget it again. Now that I've got my bird.
I hope that is on your implant. You'd be like, oh. There's always at least one person in the class that's like, oh, what was that running class? It was on my test. And I know I got it right. Like, I already missed it in here. And you're like, oh, so bad that you never even forget it. Yeah. Alright, so we have a nice picture here of the division color-coded for us. So do notice at the hip, the attachments, the separation points. So our pelvic bones are part of the appendicular. But the sacrum, which is the base of our spine, or we call it our vertebral column.
Yeah, I thought you were talking, I thought you were talking about the sacrum.
No,
I'm like,
the
okay,
sacrum is at the
conversation.
base of our. Sorry. I'm sorry. At the base of our, you couldn't see my phone. Okay, and then the attachment point around our ribs is at the, remember the sternum is part of our axial, so our clavicle and our scapula, which we call shoulder blade, is the attachment point of the appendages, okay? So it's not just the arms and legs, it's the attaching bones too. That's the part that you need to probably focus on, where they separate at.
I have a question real quick.
Yes?
Okay, the lumbar vertebrae
Mm-hmm.
versus the thoracic, is that the front side versus the back side, but the same thing, or what is that?
Lumbar is your last thigh,
Right.
sacrum. Thoracic is between the neck and the lumbar.
Okay. Okay, I saw different things here, and I was like, what is, I don't understand this, but I think.
And see, they have it identified on front and posterior and anterior.
I see it now, I was not seeing it over here, I was just seeing it on this side.
That's okay.
Right.
Yeah, good. Alright. Okay, so that's the end, that's where we're stopping studying chapter 7, okay? We will pick up, we'll do some reference to the rest of these parts of these chapters when you learn the bones of trail guides, okay? So you're only studying to page 200, basically. I have it written in your weekly assignment, but you can circle the page if you want to. But it's pretty easy. It stops at the separation picture. Okay?
So we don't have to just 202 through whatever, not just.
We're going to learn those in sections.
Okay.
Okay, and I know this is like a really dumb.
Unless you guys want to, like, clean, sweep, and learn all the bones.
No,
I'm
that's
good.
Good.
So now, but like when it comes to our quiz this week, it covers the entire chapter. Okay.
No, that's what I'm saying. Stop here at the picture. Okay?
Okay.
You guys got that too? But it's on your, it's noted on your assignment.
Right.
Your read pages. Okay. Now, let's look at chapter 8. Again, we're going to do the first part of the joint chapter. Alright, so turning to page 236.
Oh, boy.
Loveliness. Okay. Yeah, I used to do the intro to muscles to the sleep separate. But that's too good.
So intro to muscles, you did the whole skeletal system and joints and the muscles? God.
For the second class. Because they wanted it super fast, so we condensed some stuff. But then I said, no, this is not good, and I put it back to mine.
Yeah, I was about to say, because I mean, that probably showed us some crazy people.
That was,
Because that's a lot.
and I said, leave my schedule. You see what happened? Okay. So, chapter 8, joints. So, basic design and function of our joint. So again, a joint is called a articulation. From now on, no, you can still use joint. But just don't look at me if you have no idea what I'm talking about by the articulation. Okay, so again, here, design and function depend on each other. Because, like for instance, the elbow, it cannot go in a circle. It is made for flexion and extension. It can't do all that the ball and socket articulation can do. Okay, they function the way that they are designed to. And of course, it has to have at least 2 bones to be a joint, and they have to work together. They depend on each other to get their job done. The more stable a joint is, the less mobility it's going to have or be capable of. Does that make sense? But the shoulder can do a whole lot of movement. It's also one of the most highly dislocated joints because you lose stability to gain movement, okay, and all of the different vascular planes. Alright, so connective tissue and joint structure, 236. So, connective tissue is used in our joints, in our ligaments, tendons, discs, all the parts of joints and their soft tissue structures. The way that everything has to fit together, the shapes have to match, the muscles have to contract to pull on it, and it's only going to pull within its joint capsule. So, the elbow, for example, is very stable. It has a bone-on-bone stopping break, basically, right? The bone hits the next bone. You can't extend any more than that. The bones are touching, that's it. But then there's a lot of different ranges of motions in people's shoulders, right? I have super high motion in my shoulders, where other people are very rigid. So if I like demo a stretch to someone, they're like, "Ooh, I wish I could do that." Well, we'll just do it to you wherever you're at. So you have to remember that when you're working on you, sometimes you're going to test and see where is this client's range. Because I can't just take their arm and just flail it back and pull. If they can only go here, they can't go past their head, then I'm going to be causing pain, and they're going to constrict and tighten those muscles that I'm trying to lengthen. Okay, so there's a fibrous component of the matrix, and it has collagen and elastin, like we mentioned. 2/3 and 1/3. Collagen is white fibrous tissue. You do need to know that. It's dense, fibrous white tissue. It is similar in strength to steel for its ability to withstand pressure, and it is there for stability of the joint, the collagen. It does have piezoelectric properties, but it's going to have a ropey feel, okay? Elastin is yellow fibrous tissue. And as we know, elastic, it is much more free moving, allows more movement, which that means it's going to have less what? Stability. Yes. So white tissue is going to be more stable. The yellow elastin more mobile, but less stable. So more rubbery. The joint capsule is dense. It attaches to the bone. It's kind of a sleeve around the joint to give it its space. You can't move it outside of the capsule. Ligaments are made up of 70 to 80% collagen. Noted there at the bottom of 237. And that allows them to have some flexibility because they are 30 to 20% elastin, but not as much as some other connective tissue. A tendon is also dense, but it connects bone to muscle, as I mentioned. So it's also stable. It's also a stabilizer, just like a ligament, but it will have less support than a ligament will have. So it can limit your range of motion of the joint. If your tendons are super tight, then your range of motion will be reduced from its normal range that the joint is supposed to have, however many degrees. A bursa is a flat sac of synovial membrane, and these are found anywhere that we have structures rubbing over each other. So the knee has a bunch, hips and shoulders have a bunch, but you find them in other places too.
Is your
Like
little tiny, little
bones.
tiny, but not, like we have big
Nothing
fat,
big,
yeah. It's more gonna be in larger joints. Anywhere we have, the body can form bursa if we're putting the demand on it. Just like it can form calcium deposits to stabilize an area, it can also form bursa if needed to cushion the area. So that's going to make it appear kind of a little bit swollen looking, and it's a soft little squishy pad. Cartilage. We have 3 different kinds. White fibro cartilage, yellow elastic cartilage, hyaline cartilage. So the white and yellow are following what we've learned. White's going to be more dense. It's going to restrict motion. It's going to have more collagen. That's why it's white. Yellow has more elastic in it than anything else, so more flexibility and mobility. Hyaline, this is the new one. This is a thin covering. It's found on the end of bones, okay, wherever we have our articular cartilage. It is hyaline cartilage. And it is very smooth. It does not cause much friction there. But it helps to distribute stress put on that joint. It helps distribute the weight evenly over that surface. So it helps take some of the pressure off. Little shock absorbers. Even though it's a connective tissue, bone is, of course, the hardest of them. So it's not the most dense matrix, as we mentioned. It has a cellular component, ground substance, and fibrous component. Next, we're going to talk about viscoelasticity of connective tissue. So all connective tissue is viscoelastic. It has the resistance to change of its form, that's viscosity. And elasticity is the ability to go back to the shape that it was before you mess with it. So we stretch something, we lengthen it out, but it can go back. Okay, so that's what elasticity means. It's not going to let you, or it's going to try to fight you from, dislocating it, changing its shape, right? The muscles have a shape. Our pec has a shape. Our traps have a shape. Okay? They're going to maintain their shape, and that is viscosity. You can only change it so much, and then that's why we have a stretch. We start feeling, okay, we're about at the end of that stretch. That's it. And on that note, talk about a couple other characteristics. We have creep. That's in italics at the bottom of 238. This is where, in a normal condition, when you apply force, it will slowly, over time, go back to its normal shape. Even though you displace it, it will slowly go back. It's creep. Yes, if it continually happens over and over and over, a forceful deformation of the bone, it will eventually change its structure, and of course that will alter its ability to function. It won't function the same either. Okay? Like people's toes that wear too tight shoes, eventually toes change their structure, and then you can't walk exactly the same either, and you start developing other issues and changes. Just as an example. Okay, plastic range. This is when we are exceeding its elasticity. We went over the 20 to 30%. This can permanently deform it, and it can't go back to its regular state. Okay? That's when we'll have a break or a tear happen in the bone. We went over its limit of elasticity. It's just like a rubber band will break if you stretch it too far. Bones will break it. Okay, now we got a couple other italicized words of note. We got rupture, of ovulation, and fracture. Just go over it. Don't study the heck out of it. Okay, you'll see these later in pathology when we start talking about things that happen for dysfunction. But a tear is a rupture. It's another word for a tear. Ovulation is it's not injured. Okay, the ligament is not injured. And then failure of the bone is called a fracture. So it just couldn't hold up to it. Laxity. This is when it is too long. You stretched it or traumatized it for too long, and it can't stabilize anymore and do its job properly. Shortening is when, of course, it shortens and it becomes dehydrated. Those are not super key points. These are just nice to know information. Okay, next we'll talk about mechanical forces. We have compression, tension, bending, shear, and torsion. Compression is a mechanical force applied. We use it in massage sometimes. It can stimulate, it can help with pliability coming back, it can help with circulation. Sometimes it can cause bruising, but hopefully we won't be doing that much compression. Tensile force or tension is when two ends are pulled away from each other and we create tension. We apply tension for some kind of joint stretches. This can increase pliability and help it get into alignment if it just needed to slide a little bit into place. Legs, you'll see us do that on legs a lot, but arms also. Bending, this is basically when we're doing kneading, which is called designed last week, starts with a P. There we go.
Okay, I was like, I thought you were like stopping.
I didn't know it was just
I was like,
I ask questions for answers. Make sure you're awake. Okay. So bending is basically when we're messing with the muscles and the tendons, and they move according to the force that we're applying. Okay, that's the viscosity. It changes, it moves it, and then comes back. Right. We're not forcing it over the limit. We're changing its shape temporarily, compression, tension at the same time. Okay, compression and tension. Shearing is sliding across, so kind of like a cross fiber friction. We're sliding them over each other. And this creates therapeutic inflammation to help recover the injury. Torsion is twisting. Can you think of which technique we learned last week that you could consider to be torsion? We got it. What is it called?
Ringing.
it's
Ringing
ringing is the
or-
nickname. It's
Oh, no.
It's okay.
is it
Don't give me that. I
is
got
it
one. I
cross-
got 50%.
is it cross? It's not cross fiber.
Cross.
It's
Friction?
no, it's an efferage technique that's also combined with massage.
Horizontal.
That's it.
Yeah, horizontal what? Yes,
It is.
horizontal sliding.
Ah.
Sliding.
I was like, it's a pinch massage and efferage technique.
But not too much oil, because then you're sliding over the skin. You're
Yeah.
going to make them slide
Yeah.
into each other. That's right. See,
It's
it's all coming into a
It's
picture.
massage and friction are the two weak places.
Wonderful. Great. Okay.
You said ring one like I know.
I was like, I know what this is. I can't think of it right now.
I tell all the time, I tell you guys, I'm like, you guys are the people that when you take your test. They're like, you're moving around a lot. I don't care. You do it and then it triggers your brain, great, you use it. But you're not talking, you don't have notes, so they can't say anything. So when I stood up and I did this, I was like, oh, geez. I was like,
in the middle of
Don't
your
say it out
intellects,
loud.
so it's just be like,
They're like, aha!
What movement does the shoulder do? Okay. Joint categories. We have 3 of them. Synarthrosis, amphiarthrosis, and diarthrosis. The most mobile is diarthrosis. Amphiarthrosis is in the middle, a little bit of mobility. The smallest amount of movement is by joints that are synarthrosis. Okay? Diarthrosis is the only synovial joint of these 3 categories. And if you know that fact, you should know that it's going to allow the most movement. Because synovial fluid is found where we need the hydration for sliding over.
the diaphoresis is the mental.
It's the only synovial of these 3. It allows the most movement. So a shoulder and hip are going to be diarthrosis. But the skeletal bones will not be. They'll be, if they are, we have a problem. Because of developmental issues. Okay. So let's talk about these. So synarthrosis is nicknamed fibrous. So this is going to be bone-to-bone connection. So suture joints are synarthrosis. These are found in our skull bones. So they have a dense, very thin, dense fibrous tissue connecting both of their periosteums together. So these are sutures between our skull bones. We'll learn that in a couple weeks again. Gomphosis has peg and hole. That would be like our teeth. Okay, so again, there's not much movement at all. It's not supposed to be. We're going to talk about what they're made for, not what happens throughout the choices. Okay. Syndesmosis is for articulating bones. Okay, so that's going to be like our tibia and fibula. They don't move a lot. Okay, but they do come together up here, and you have again for these 2 here. But again, they don't move a lot. Okay. Amphiarthrosis are nicknamed cartilaginous joints. They're slightly mobile. Still, we don't have synovial fluid there. We have 2 types of these, symphysis and synchondrosis. Chondrosis, telling you, is going to be cartilage. Symphysis, it does have hyaline cartilage, but they're separated with discs. The cartilage is in the form of a disc, so that would be where we have discs that you know about. Yes. Which is called our vertebral column. Yes. It's coming. Vertebrae, we work with that too. But synchondrosis is going to be, let's see, near the ribs. We have it there. And we have it at the end of our long bones also. Okay. Diarthrosis, these are synovial joints. Again, freely mobile. So they're going to have a lining of synovial membrane to release that fluid. And that's going to be all the other very mobile joints. Fingers, arms, legs, neck. Okay, so hyaline cartilage is going to cover those joint surfaces. And you've got the different pictures showing you each type of joint. Okay, on 244, talk about the joint capsule for a minute. It is made up of 2 layers. The stratum fibrosum is the outer layer. The stratum synovium, inner layer. You should remember the outside needs to be for protection, so it's going to be fibrous. So fibrosum is the outside. Synovial fluid on the inside. Synovum is the inner layer. And so this is showing you the knee joint, with the patella. So we have fat pads, we have meniscus, we have bursa all in here. You have the synovial membrane lining the entire surface where these bones are going to slide. Okay, see that? The whole part where this bone, as well as the patella, can slide in front of this bone, we have a synovial membrane. Okay, and then we have the bursa there for extra protection. And we have a layer of fat adipose tissue for extra cushioning as well. So that's what it kind of looks like. Synovial fluid is colorless fluid. It's kind of like egg white, thick, colorless fluid. It's for nutrition and lubrication around the joint. Motion principles. Okay, arthrokinematic is involuntary movements that happen inside the joint capsule. So at the joint surfaces, those movements. Rolling, sliding, spinning over each other. So that's going to be where the two bones meet, arthrokinematic. There is joint play, which is, you gotta have a little bit of ability to move to function. It's essential to function normally. It's called joint play. And it's usually about 1/8 of an inch for humans, the amount of play that we have in a joint. So there's, a little bit of range of motion differences that's normal, but not huge. Osteokinematics is movement that the muscles create. Okay? So that's going to be our range of motion. Is movement that the muscle creates by pulling on the bone levers for the movement. So there we have the accessory arthrokinematic movements, spinning, rolling, sliding. Depending on the shape, it'll look a little bit different. So we have too much joint play, or a hyper amount, then it's unstable, high risk for injury, tearing, and too little is not able to do normal movements. Okay, it mentions a couple things about the movement types. If we have the physiologic range of motion is active range of motion, what someone can do when they're doing the movement. There will be changes in that if they are passive and you do the movement, because then it's not going to cause pain because they're not taking on the weight of their body parts. Okay. Pathologic is going to be when they cannot reach it or it is excessive. And anatomic is what it's supposed to be able to do within the joint. Infeel, that's how we distinguish the changes. It protects the joint from excessive traction and massage applications. So we can have 3 different types of infeel. It can feel soft, hard, or bony. So again, the elbow is going to be which kind? Soft, hard, or bony? Bony. Then there's a soft one and there's harder feels depending on the joint. Next, talking about stability of the joints, we have the position of the joint makes it either open or loose or closed. And you'll have more stability in a closed position, which is aka locked. So the elbow has more stability in extension. Does that make sense? It is at its end point. So if you put force on it, bam, it can withstand more without getting with risk of injury. If it's bent like this, it's more likely for fractures and injury. It's less stable. So this is loose packed position. This will be closed packed position. Okay, so more stable when it's closed packed. It has the support of the surrounding structure, whereas this way. The body has nerves and things sticking out too for injury. Okay? They have a third one, least packed, but the main two are closed and loosed. Okay. The movement of the joint is usually for whatever plane that it's in. So we already went over that. So frontal plane movements are abduction, adduction. It's within the frontal plane of the body. Flexion extension happens in the sagittal plane because it can all happen on that side of the body. And then the transverse plane is rotation, pronation, or supination. They're all rotating movements in the transverse plane. So, we have a lovely list there of all the different movements that can happen that you're going to learn through this course, and which areas do what. And it puts it with what type of joint, with the joints, what movements it can do. It has some pictures with some normal degrees for each joint and movement. You do not need to memorize those, okay? Last thing I'm going to cover is on page 250. There's uniaxial, hinge, and pivot joints. Again, hinge lets you do flexion extension. Pivot is rotation around the bone, so that only happens at the head for us. Uniaxial is a movement that only happens in one plane, in one axis. Condyloid, biaxial, of course, two planes and axes. Condyloid and saddle are those type of joints. And triaxial is the ball and socket or gliding joints. The kinematic chain is the last thing we're going to do on this chapter. There's closed and open. Closed kinematic chain, that means that the joints are linked with their motion. So you cannot move this joint without affecting this second joint. So you cannot the ankle and hip is the example that they use. So like I can do this, it's not affecting this or this. I can move these, so this is open. Okay? I can move each joint separately. This doesn't have to do a particular movement for me to bend my elbow. Okay, so that's open. Closed would be hip, knee, ankle. If I go to sit in the chair, the ankle has to move a little bit to allow the hip to do this. This can stay straight. These have to move together. This is the closed chain. Okay, they don't have a choice. It's been decided for them. If hip decides it's going to sit down, ankle has to give. Okay? That's the simple explanation of that. And that's all we're studying for chapter 8. So we're stopping on page 252 in that chapter.
There's a little part of it that goes over.
I know, it does. But at the end of the section.
So you said we do not have to memorize 249?
No, you're gonna memorize that as you learn each muscle and what it does, what movements it does. Alright. The one that I do want you to start being familiar with is medial rotation. So that is moving toward the midline of the body. Okay, whatever body part. So if I'm in an anatomical position and I medially rotate my arm, which way is my thumb going to go? Is it going to go anterior or posterior? So I'm going to medially rotate my arm from anatomical position. Should my thumb point towards you or towards the door? Yes, if it's going to go towards the midline of my body. Okay? And that applies to any body part that can do that movement. Alright. Let's take a couple-minute break before we do tapping. Separate science from technique. I was going to look back and see if it came through since I looked at it.
Yeah, can you look at mine as well?
Mm-hmm.
Did I find the right thing somewhere? Actually had some service yesterday.
I saw that. Look at Callie.
What was it? Actually, it was late last night. But
I know, it tells me the time.
does it? Okay. Well, work has been so crazy that I'm just like, I'm getting it done.
Yeah, so I'm like, dang, 11:59. Okay.
Yeah, no, I was like, I'm getting it done tonight.
Okay. Let's see.
Okay, I was like, wait, what's this?
Giving you the time.
It's like, what did I do?
What did I do?
That was well known. Week.
Yeah.
Three. Last week, maybe, or week before?
Week 3.
Well, 2 weeks ago.
Mhm.
Yeah. No.
Sometimes mine will let me submit and sometimes it won't. It just depends on what mood my internet's in. But it works fine with my work. That's what doesn't make sense. Like certain things it will not pull.
Oh, that device?
For my computer, like at home, like if I'm trying to stream certain things, certain websites, it just will not work.